Okay, good evening everyone, and thanks for joining us for today's Scrutiny Children Services Review Group. I'm Councillor Lee Bridgen, the Chair. I'll just run through the pre-meeting notices. So, the meeting this evening will be live streamed to the public. A recording of the public part of the meeting will be available on the Council website within 24 hours of the meeting. Remote participants joining the meeting using Teams, please turn cameras on when speaking and use the hands up icon to indicate a question or comment. Turn microphones and cameras off when finished. Those in the chamber, please remember to switch microphones on when speaking and speak directly into the microphone and turn off when finished. And attendees in the chamber, please make sure you switch phones off or place them on silent mode. If you need to take a call, please leave the room and return when finished. And on that note, I'll just make sure that I'm on silent, because that would be embarrassing. Okay. Right, so get my screen lock off. So, moving on to the first item of the agenda for this evening, which is apologies for absence.
Yes, Chair, there's been apologies received from Joe Miles and Dr. Sultan.
Thank you. I don't see any other hands raised, so we'll move on to the next item of the agenda, which is to confirm the minutes of the meetings on the 28th of February 2024. And also on the 21st of May 2024, which was after the full council annual meeting. Any questions or comments on the minutes? None from the floor, none. I don't think we've got anybody joining remotely, so those minutes are confirmed. Thank you. Moving on to the next item of the agenda, which is item 3, disclosures of interest. I'll get the ball rolling by declaring the interest that I'm Governor of Summaries Junior School. We'll go with Councillor Khan first.
Community Governor at Dallow Primary School.
Thank you. Councillor Keynes.
Governor of the Virtual School and Queen Elizabeth School.
And Councillor Hussain.
Governor of Downside Primary.
Any others? No other hands up? Okay, thank you. Moving swiftly on to the next item of the agenda, item 4, which is urgent business. Nothing's been brought to my attention. Okay, so no urgent business. References from committees and other bodies?
None, Chair.
Thank you. Under item 6, I have no updates to give, so we'll move swiftly on to the reports, the first of which is under item 7, and it's the Children's Services Improvement Plan Highlight Report, which is on pages 20 to 25 of your agenda pack, and I'll hand over to Paul for that.
Thank you, Chair. Good evening, councillors. As shown in the Highlight Report and Programme Plan, we're continuing to make good progress against all our improvement activity. So I'll take you straight in, if that's okay. So theme 1, improving quality. So just some key highlights. The Regional Foster Hub recruitment has, the recruitment for fostering is now up and live. It went live in May. Our Social Work Academy review has been completed and we're due to take a paper to present to DMT. And just on the Social Work Academy, our first cohort within the new ASYE year is being recruited just now. Our practice framework has been reviewed and is currently in the process of consultation with workforce and partners. And we're also partnering with Frontline to provide an additional route to grow our own and recruit further social workers. We have been working on our Families First for Children Pathfinder programme, and we've now delivered our costed plan and submitted this to the DFE, and we've since had subsequent meetings with the DFE, providing them with clarification on a number of points. They're broadly very happy with our approach, and we're working to tidy up just a few of the smaller details that they're looking for confirmation on. We're also recruiting into, so recruitment is underway for the posts within the family help team, and we expect to stand up a small team at the beginning of July. Our issues remain around recruitment. However, our recent agency figures show that we have reduced the number of agency staff within the system from 34% to 27%, and we're on target to achieve further reductions by the end of this financial year. So moving on to theme 2. So we're undertaking a review and refresh of our work to deliver a child-friendly Luton ambition, which is looking at the whole programme of work again. We have undertaken a huge amount of work with our children and young people already, and we've got further feedback coming from the SHU survey into this to help us design what we're going to take forwards. We're going to bring an options appraisal paper to DMT in July. The Family Partnership have been undertaking an extensive mapping exercise to build a database of all local resources and services for our children and young people. And this is now being developed into an online resource which will be available to our whole department. We've stood up our Pathfinder training plans, and we're looking to train our staff. There's a number of roles that are new, so the Family Help Lead Practitioner and the Lead Child Protection Practitioner, but particularly the Family Help Lead Practitioner roles, we're looking at how do we design that so that more staff and alternatively qualified staff can undertake that. We had a very successful conference around Families First on the 4th of June to launch the Pathfinder for staff, partners and the voluntary sector. And this included experts by experience who provided some really fantastic keynote they were fantastic keynote speakers. And we had one of our Wave 1 colleagues who took us through their experience of the journey they've been on so far. It's all a very positive and very helpful day. Theme 3, we have been looking at our TRIEX. So TRIEX is where we store all our policies and procedures. So we've reviewed and updated this. We are due to provide another upload this month, and that will be done at the end of the month. But we are sense checking that as part of our Ofsted preparations and Annex A to make sure everything's as it should be. We have been looking at LCS and I's, and I know that this was an issue for CSRG in the past. Actually, we have been able to identify through the Families First programme additional resources to support our ICT client team to pick up some of that work and to manage it. And we currently have a ICT work stream within the Families First programme. Theme 4, we have been reviewing we've reviewed our foster panel processes, and we're now just embedding those. We had a Fostering Family Fun Day that went ahead at Manor Hub, run by the Family Partnership, which was very successful. And we've had some training of our governors that took place on the 1st of May. We also undertook a SEND deep dive, and we reviewed that at the SEND Strategic Working Group. And that involved looking at a number of cases and following them from the beginning, from when they were known to us right through to them receiving the support that they did. And it included both children and young people with an EHCP and those with SEND support. It was a very useful exercise, and we're developing an action plan from that. We've been working with our Parent Care Forum to establish a communication plan and to help them build their strategic plan, because we realised that there was a bit of a gap there for them. We've stood up our SEND strategic work streams, and they are now up and running. 8 themes across the system around the SEND strategy, and that work has started. We have been in discussions around the MASA multi-agency safeguarding partnership discussions, looking at how we strengthen the role of education and what changes are required to the independent chair role. Part of the Working Together 2023 that is also part of Pathfinder, but Working Together 2023 has to be in situ by December this year. Theme 5, our partnership development work continues with discussions for both family help and the multi-agency child protection teams that are underway. This is again part of the Pathfinder programme, and that our key partners are the police, health and education. And we're working closely with them to develop those multi-agency disciplinary teams, both in an operational sense and for the child protection team. We've had fantastic engagement from our partners, and strategic leads were there co-presenting at the conference on the 4th. I apologise, that was a whistle-stop tour, but there's a lot of work in the system. Happy to take any questions.
Thanks very much. Before I ask any questions from the floor? Councillor Hussain, yeah?
Can I ask you, in terms of the foster care training or foster care local, in terms of trying to get the target, are we on target on that, getting local foster carers? Locally?
Sorry, Councillor, could you repeat that?
Yeah. What I'm asking you, in terms of the foster carers, training or approved foster carers, are we on target to get the local, Luton-based foster carers, or are we still relying on the agency foster carers?
So if I take that question, Councillor Hussain, so at last count we had somewhere in the region of 160 approved foster carers in Luton, against a backdrop of close to 300 looked after children. So that should tell you that we are still heavily reliant on an independent fostering market, not just an independent fostering market, but also an independent residential market. So our fostering recruitment sufficiency strategy very much is focused on our recruitment and retention of foster carers, but also developing our in-house residential provision, Wigmore Hole, which has been developed and it's ready to open. We're just waiting for Ofsted registration of that unit. We're expecting that to happen imminently. And the aim of both these strands of work is to recruit more foster carers permanently into our Luton family so that we can place children closer to home, but also have a residential unit for some of our young people with the most socially, emotional and mental health challenges to also be closer to home. In terms of our target, we have seen an absolute increase in our reach to in the number of inquiries we've been receiving, and as a result of a new marketing recruitment manager post that's been appointed to in the fostering service, our response to that to those initial inquiries has improved significantly. But as you know, fostering recruitment process is not a short-term process. It takes months for a foster carer to be assessed and then fully recruited. So we're not likely to see the impact of that in the next few months. It's going to be towards the end of this financial year that we will start to see the numbers of newly appointed foster carers increasing.
Yeah, my concern is that we do local recruitment, and I've seen a number of times that, we have a stall in the Arndale or in the around the town, and even in the sometime in the other community festivity. What I have seen is the independent sector is more aggressive, trying to approach the people rather than just standing there, which we do unfortunately, and having people really approaching the people, because most of the people are reluctant to even pick up a leaflet, or even don't even realize that they can foster children locally if they wish to do that. So could I ask that we do, just as I was even pulled down as I was going up the escalator in the Arndale if I wanted to foster, and this was the independent sector not a few months ago. So I think we need to take their example and be a bit more active rather than just stand that somebody will come to us, rather than just asking people if they are interested. So that's what I'm asking you, because if we are to, and the last question to you would be, is how far is the furthest we have got any of the children in foster care? what distance is any of the children now furthest away from Luton? Do you have any idea? I think that would be helpful to members to see that information.
We can certainly factor that into a future CSRG item, perhaps with the Chair's agreement. We can take it into the planning meeting of the future, Councillor Bridgen, if you're happy with that. I think just to respond to the previous point, you're right, there's been a lot of profiteering that goes on in the private sector, and as a result of that profiteering, they have more aggressive tactics, perhaps, in the way in which they recruit foster carers through added incentives. But actually, we're not far off behind. We have really pushed for our regional rates for foster carers. We have now provided additional incentives to the council tax scheme as well for our foster carers. I met with our foster carers for a coffee afternoon and actually hearing some really positive feedback from them about the new approaches to the way in which we're building the fostering family. I think our work with the regional fostering recruitment and retention hub, as well as the Mockingbird program that we're going to be implementing, these are all our absolute approaches. What we don't want to do is have an aggressive tactic for recruitment and not deliver in terms of the support that foster carers require in meeting the needs for some of our most vulnerable children. So we want to do it as a sustainable approach to building a community of foster carers that can stand the test of time, as it were.
Thank you. If I just come in on sort of the forward plan, I think we have got a foster care report in the forward plan, so maybe could be covered in that, but we could cover that under the appropriate agenda. Councillor Hussain, you wanted to follow up?
Just to the last bit, really. I think we have, a number of councils do, and I think we were talking about it some time ago, where we have in a new build, and some councils have done that, where they are having a new build and there is a certain properties that are for foster carers, families, people that wish to do that. Some local authorities have done it very successfully up and down the country. So it's something that we can look at, because not every, people do want to foster, but their property may not be suitable for fostering. So it's something that we need to learn from other local authority. I think Housing was talking about it a couple of years back. I'm not too sure what happened to that.
We can certainly make some inquiries on. I think the reality is we, as part of our work with our property and infrastructure team, we always look at all options and alternatives. So if we've got a foster carer, if we've got a resident who's keen to foster but requires some support with adaptations to their home, absolutely we can support with that, and we have done that. So we've got examples of children with disabilities, for instance, requiring adaptations to their homes so that they can be supported in a new foster carer's property. But we can certainly take away the query about new builds and ring fencing numbers of accommodation. I think I haven't come across that myself, Councillor Slane, but I can certainly take some inquiries back.
And actually, just to add to that, I might take an action on sitting on the local plan working group to see whether that's something that can be provided for in the local plan as well, provision for foster care. So I'll perhaps take that as well. So we'll go on to Councillor Keynes next and Councillor Khan afterwards.
Thank you. You mentioned, is he listening? Are you there? Sorry. Carry on. Right. You mentioned Wigmore Hall, and it was near completion. I was only asked on Monday what was happening up there, because the hoarding is still up, and it doesn't look as if there's any work even being done.
Thanks, Sarah. And I think I've got the same question as well. Do you want to cover that in the same way you did with me? Thank you.
Yeah, that's fine. So Wigmore Hall work's complete. We are waiting for Ofsted registration. As a result of not having Ofsted registration, that unit cannot open because it would be an illegal placement for children. So the application's been in with Ofsted. I was saying to Councillor Bridgen earlier that I know that Ofsted are going through a number of requests for registrations. Obviously, they receive them nationally, So we're just waiting for a response from them. But as soon as that's in hand, we'll be able to open the unit.
And, I mean, I understand it was probably the same person who contacted you, contacted me, that the building is perhaps boarded up at the moment, and that might be for security reasons as opposed to...
That was going to be what I was going to say. Is
Yeah.
perhaps we could take the boarding down, unless it is a security problem, to make it look as if it is actually being used, or attempting is finished. Can we look at tidying the place up a bit from the outside?
No, we can take that back, yeah.
Thank you. Councillor Khan?
Thank you, Chair. So my question relates back to the adaptations for potential foster carers for children with disabilities. As someone who works within the disability housing sector, I have a couple of questions, if that's okay. So the first one is, I know that usually in sort of like social housing settings, the adaptations can't start unless the tenant has moved in, because the DFG grant can only be given once you are a registered tenant. Is that the same case for foster children? So they can't actually give the DFG grant unless they've moved into the foster home. Is that sort of similar sort of thing?
I'll take that query back, Councillor Khan.
And the other question is around, so how many children with, I mean, you might not have the data to hand, so I'm happy for you to come back to me on this, but how many children do we have in the foster care system that do require homes with adaptations, and whether we have new builds that meet the M42 requirement? The M42 is adaptable and accessible homes.
Well, we can, again, bring that information back. The other space where the level of detail we go into for foster care arrangements for foster carers is the Corporate Parenting Board. And I would welcome any councillor, because you're all corporate parents, to please come and join, because I think that's a really useful space where some of the detail around, both in terms of foster care numbers, recruitment, and numbers of children, such as the breakdown you've requested for adaptation for disabled children, can be brought there for further scrutiny as well. But as Councillor Bridgen said, we've got this on the forward plan, and we can take a note back to make sure we cover that question off for that meeting. Thank you.
Thank you. Councillor Fry?
Yes, thank you. My question is around the SEND deep dive. Could you give me a little bit more information about what the lessons were learned, please?
I can. I just need to quickly find. So one of the critical things that came up was it was around communication. How do we establish who do we need to speak to and when? So it was just having that central inbox. We had a lead who took it on, but actually it was a bit more difficult when we were trying to establish, particularly because some of the children are SEND support, so they're not held on our databases and our systems. So we had to identify the schools and then identify the best person within the school and then the best person to speak with that family to ask permission to then review their case. So luckily we managed it, but we came up with a better solution to being able to do that. So that was one of the critical lessons. And the other was really about that SEND support. So it was about, because we don't have sight of that, how do we get that information and how do we understand and how do we chase it down? So that was, again, just about putting another process in place.
And was there any outcomes on how you improve the EHICs getting out? Because they're a bit slow at the moment, if I remember rightly.
Sorry.
The educational healthcare plans, I think the turnaround of them is quite slow, if I remember right from OSB.
Yes, it is a capacity issue within the service. The service has gone through a restructure, and it is improving. I don't have the figures to hand to say what they are. I think Paul does, though.
Yes, I think post-COVID there was a significant increase in demand for EHCPs, which led to us being unable to process sales in time. We've had a lower completion rate within the 20 weeks of around 32% in the past. It's improved over the course of this last couple of months. And if you take into account those EHC plans that are completed just after the 20 weeks, between 20 to 25, the completion rate is 67%. So it's just those that are just missing that, but it is on an upward trajectory.
Thank you. Any other questions or comments? Yep, Councillor Petts.
Firstly, are we making progress with absenteeism? And if so, how is it being achieved? Are we working closely with MASH to achieve it? And the other one really is one that I've asked numerous times is, are we still in touch with any of the unregistered schools in Luton?
Just in relation to absenteeism, children are not attending school, we have an attendance support team that work with all of our schools now and take up cases that the schools identify, and they're working with the families to try and promote better attendance. So our persistent absence is not as good as it needs to be. We need to reduce that. But we are working through our attendance team alongside schools through each of the neighbourhoods to try and make sure that we're on top of that. In relation to unregulated schools, I think that may be covered in the next report that Caroline is actually presenting, because there's certainly a piece of work that has been done about unregulated schools and also about independent schools as well.
Thank you. Any other questions, comments? No? Okay, great. I think the recommendation was just to, if I scroll back, just to accept the report, receive the report, which we've done. So thanks Paul, for your report, and for officers for their responses to our questions. Okay, so moving on to the next item of the agenda, item 8, which is Schools Ofsted update on Luton schools, including independent schools. That's on pages 26 to 28 of your agenda pack, and that's with Caroline Dawes.
Thank you very much, Chair. So Councillor Pett's question was very pertinent to this. So this is an overview of the quality of our schools from a regulatory perspective across the town. And just as part of the context, if you think about local authority maintained schools, we support all of those schools that belong to the local authority, that are maintained by the local authority in proportion to their need. Academies can buy our services, but we have less influence over those and less direct control over those schools. And our independent schools, which are located in Luton, we have very little influence over them at all. So the scope of our control and our influence is limited. But the overview is a pretty positive picture. So you can see the data there. I won't go through it. Everyone's read it, I'm sure. I think of note, however, is the fact that our outstanding schools are well above the national picture. We've got 12 schools which are outstanding, which is around 20% of our schools being outstanding. Nationally, it's only about 12%. So that's a really strong picture in Luton across our state school sector. In terms of independent schools, some members will remember a while ago as having some concerns about our independent schools, a lot of whom were inadequate for safeguarding. We set up protocols and systems despite or working around the restrictions in terms of our influence. And I'm pleased to say that now currently we've got a much stronger picture. And now all of our independent schools are at least well, they're all good or better, and everyone is meeting the independent school standards, so we know that our children are safe in those schools. Councillor Pett's referred to unregistered schools, unregulated schools, which are illegal. Again, as a consequence of the part of the work of this group, we set up an unregistered schools strategy and a protocol which has been shared widely with other local authorities who have similar challenges. And this year there were 2 cases that were referred to Ofsted as possible unregistered schools. Neither of them met the criteria. So we don't have any, as of this moment, unregistered schools in Luton. So any questions?
Councillor Hussain?
And can you confirm, because there was a comment made the other day at another meeting, in terms of the maintained school, the local authority school, is there any of them which is inadequate?
No. There are no
So,
inadequate maintained schools.
So it is the academies that we have a problem which has gone on for quite a considerable. My concern is Stockwood Academy, because that happens to be in my ward, and I know quite a bit about it, but it seems to be that shared learning is no longer the people that are now responsible for that. Is that right?
From the 1st of September, Shared Learning Trust will merge with a Trust Advantage Schools
Right.
from Bedford. But we have 3 inadequate...
Sorry, Karen, could you put your mic on?
Sorry. There we go. We have 3 inadequate schools. It's a little unfair for us to say that they're all academies and that's an issue with academies, because if a maintained school becomes inadequate, it has to become an academy. So we can't really draw those comparisons. But it is fair to say that our RI schools are in the academy sector, but they are improving. We work with our multi-academy trusts around their school improvement strategy. We work with the CEOs, we work with the DFE, and so we do share any concerns, and we work with them. And schools are being inspected all of the time, but it takes a couple of years for an RI school to be revisited, so there will always be a delay.
Really, the concern for me, really, personally, is in terms of Stockwood Academy and Linden, which has gone on for quite a considerable time. And that really is the one that I think, you know, I know you've been working very closely and trying to get those schools improved, but those children get only one chance in their lifetime. They don't get a second chance. So therefore, if the school is not performing, then, you know, the local authority do have a statutory duty to ask the commissioner, regional commissioner, to look at that, because this has gone on for far too long.
Yep.
As far as I know, it has gone on for more than 6-7 years. The situation hasn't improved since the head teacher Patrick left, and things went downhill.
So what's an example, a really good example of how we work with the DFE, who is the regulator, and so sharing concerns around the lack, exactly what you're saying about the lack of progress or the slowness. And one of the outcomes of that is that the DFE issue warning notice to the trust around those 2 schools. And the solution that the DFE and the trust have come up with is to merge, be taken over by a successful trust in Bedford. So we're looking forward to hopefully seeing some changes in that direction.
If I can just add to that, and I accept and I fully understand the concerns. Sometimes when a school is not performing as parents or as the community would wish, the longer it's in that position, the more difficult it is for parents, because it's continually requiring improvement. And I think the whole point of this is that the Shared Learning Trust had trust termination notice issued, and now those schools from this September will be working under a new trust, the Advantage Schools, which is based in Bedford. I've already met the CEO. We will talk through actually the plans for how they're going to work with those 2 schools. I think the other issue, which is a concern, is actually one of our schools that is inadequate, which is Windmill Hill Special School, which has only been open 3 years, and it's been an academy from the very start. And certainly we've got concerns about how it's got into that position, and certainly we're working with the Department for Education on how we resolve that moving forward.
Thank you. So we have Councillor Keynes next, and then Councillor Carney.
Once again, you don't fill me with much confidence on academies. I'm sorry. Two of the inadequate schools, one was Wenlock. Now, that's a church school. How difficult is it to actually bring that back into proper education when the Diocese of St Albans, isn't it, got their finger in the pie?
So Wenlock has become an academy with the Diocese of St Albans Multi-Academy Trust. It's now part of that trust, but they're still a full part of Luton and the Luton family of schools. Certainly meet with the CEO and the head teacher on a regular basis to talk about their school improvement. But that is a policy that's out of our hands, unfortunately. It's around the extent to which we can keep schools that are geographically located in Luton as part of that Luton family of schools. And we're very committed to that. And trusts that come into the town understand that and we'd hope would comply with that. The issue with church schools is that they can't join any multi-academy trust. It had to be the diocese mat, so there was less choice for them. But we're still working as closely as we can with that trust.
I was actually up at Wenlock last week and I was quite impressed with the place. And I think it's come round quite nicely, and they're working very hard up there. Now, my other problem is the Windmill Hill School. It's not 2 years old, is it even? And years ago, I asked, could we have a good look round the place? And each time we were put off. And now you're coming up to, it doesn't look as if it's ever been a proper school within the precincts of a proper school.
Just in relation to Windmill Hill Special School, I think this is its 3rd year of operation, correct? Yeah. And it was always from the very start, and we worked with the department to choose a trust, because of course any new school that opens cannot be opened by a local authority. It has to be an academy. So we worked with the department and with through a competition to approach a trust. The trust that took it on had great ambitions for the school and a very strong sort of footprint elsewhere, but it's clearly based in Northamptonshire. And for whatever reason, I think they've been through a difficult time, but over the period of time it has declined. And obviously it was something that we did pick up and start having discussions with the DFE and with the trust about last November, prior to the inspection. Because we could see what was happening, but it's unfortunate that the inspection came along. It's now deemed inadequate, serious weaknesses, and the trust has got a responsibility to turn that round. We're working as closely as we can with the trust, but of course the local authority has quite limited involvement because it's not one of our schools, so we have to only work if we're invited to, or to, you know, on the trust's behalf, if they ask us to go in, or the DFE commissioners to do that work. So we are working closely with them at this moment in time, but also with the DFE to find exactly what the future will be for that school in terms of turning that round fairly rapidly.
Are you really saying that that school is in limbo? It doesn't seem to be functioning properly? Is that what you're saying?
Now, I'm saying that we're working as an academy. A local authority cannot intervene in that academy because they have a direct responsibility to the government and to the DFE rather than to the local authority. So with maintained schools, those are the responsibility of the local authority. So we can step in, we can intervene, we can support. For an academy, we can't do that unless we're invited in or commissioned to do so by the trust or by the local authority or by the DFE. The only way we can intervene is where we have safeguarding concerns, because safeguarding is still a local authority's responsibility. But in relation to improvement, it is down to the trust and the DFE to drive that forward and to make the rapid change. and we are trying to hold the DFE and the Trust to account and offering our support as far as they would want to take that on.
So you're confirming to me that it is in limbo?
No, I don't think limbo is quite the accurate word. It's operating as a school. The children are happy and safe going to school. They're engaging with the music service. They're improving in terms of the quality of education and the curriculum. So I think on a day-to-day basis, it sounds like it's improving. So there's no limbo. They're not waiting for another trust to take over, for example. They're really working hard to try to improve it. And we hope to see the results of that.
It is the only school in special education needs in Luton in an academy, isn't it?
Yes. Yeah.
Yes, we have 4 special schools in Luton. 2 of them are outstanding, and 3 of them are maintained schools, 1 academy. 2 of those maintained special schools are outstanding, and those judgments have been confirmed recently in re-inspections. The other one is good, and certainly a strong school, and the only one that's inadequate is the academy.
Councillor Khan, and then we'll go to Councillor Fry.
Thank you, Chair. So my question is, I know there's a lot of talk about, that it's inadequate or whatever, and it's good to hear that that Windmill Hill School is improving. Now, I realise it's a special school. Does Ofsted have different standards of assessing special schools? Or is it held on the same sort of standard as a regular normal school?
Yeah, so Ofsted will inspect special schools under the same framework that they inspect all schools. There is a different section in there around schools that have got children with special needs and schools with particular units and schools that are special schools. But it's the same level of rigour. I'm an Ofsted inspector that inspects special schools as well. So yes, it's equally rigorous.
And if they are improving, that's great. If they don't improve, I know that the DFE usually sets a standard where they move to a different sort of trust. Is that likely to happen with Windmill, and is that likely to be a trust within Bedfordshire or outside of Bedfordshire?
With the DFE, and that's exactly what we're trying to negotiate with the DFE, and trying to do some influencing in the background, trying to create some relationships, trying to identify a trust that would be good if it didn't work out with the trust that it's currently with.
Okay, so a final comment. I think that's great that there are conversation happening. Just a quick comment. I think it's better if the school belongs to a trust that is more local rather than belonging to a trust that's kind of like 2-3 hours away. So, it's great to hear that there's influencing going on, and that's reassuring. Thank you.
Councillor Fry?
Am I right in thinking that the church schools are all part of the St Albans Diocese in Luton?
So we only have one Church of England school in Luton, that's Wenlock, and that is part of the Diocese of St Albans, Matt. The Catholic schools are part of the, most of them are part of the St Thomas Catholic Academy Trust, which is part of the Diocese of Northampton. There are a few remaining maintained schools or voluntary aided schools in the Catholic sector, but the aim is that they will join the same trust.
But if I remember right, St Joe's, Sacred Heart, Cardinal Newman are all St Albans, and they are at least good or better, and that would mean possibly that Wenlock's going to get a good service rather than a bad service.
The schools you mentioned are the Catholic schools, which is different to the Church of England school, which is Wenlock. So the Catholic schools, Cardinal Newman, yeah, that's good. St Joseph, Sacred Heart, they're all good schools, and they are part of the Diocese of Northampton in relation to Catholic education.
Thank you. Any other questions or comments from the floor? No? Okay. So again, I think the recommendation was just to receive the report. Yep, to note the report. So thanks for the report. It's noted, and again, thanks for responding to our questions. Okay, so we'll move on to the next item of the agenda. Once I've scrolled to it. Oh, hang on. Which is item 9, the Healthy Child Programme 0 to 19 service recommissioning, and that's with Michelle Bailey and Elizabeth Elliott. Thank you.
Good evening, members. Firstly, can I apologise for the length of my report? I included the Memorandum of Understanding, which is an agreement between Luton Borough Council, Central Beds Council, Bedford Borough Council and BLMK Integrated Care Board. So I didn't really think when it came through on the list is about 50 pages, so you didn't have to read all that bit. The most important bit is the report and some of the visuals that I tried to put in to kind of explain what the Healthy Child Programme is. So just, so you hopefully read most of the report. Brief overview, the Healthy Child Programme is a statutory service that every local authority has to deliver. We currently commission Cambridge Community Service to deliver that service and have done for the last 6+ years. It consists of our health visiting service, so our 0 to 5 service, and our school nursing service, which are 5 to 19 service. There's lots of things within the Healthy Child Programme framework that need to be delivered, but obviously in Luton we have quite a lot of need, so we have a lot of our health visitors and school nurses. A big proportion of what they do is working with our families that need a bit more targeted and specialist support. So just a bit of information on kind of our Luton demographic and population. We have over 3,000 births in the town. Our health visitors have to see all of those kind of antenatally and have like new birth visits and sort of 10 to 12 days checks. We also have very transient population, so we have a lot of new families coming into the town. So our 0 to 19 team see all those new families coming into the towns and provide like a health assessment and support with any immunisations and vaccinations and additional support that they might need, and linking in with GPs and health services as well. They also do screening for vision and hearing and weight management as well. So the programme is quite vast, and as I said, there's a lot of need. So the current contract that we have with Cambridge Community Service is due to expire in March next year. There has been a new procurement guidance called Provider Selection Regime that was introduced in January. We reviewed all the potential options for moving forward post March 25, and through this new guidance, which I have included some information, and I'm happy to take questions on that because it is a new process. We are happy with the current provider, CCS, Cambridge Community Service. We don't have any issues with their performance. They're meeting all their targets and their KPIs. They have shown that they are providing value for money. We've not given them any additional monies for growth, considering our population is increasing. We have a very young population in the town. We've just heard from Caroline about the number of schools that we've got, and we've had new schools being built, so we're trying to cover that. They've also had below average inflationary uplifts every year, so we're very assured that they're demonstrating that there's value for money. What I would like to do is just to reassure members, I'm not sure it came through in my report, that although we're going to continue with this collaborative commissioning approach where we'll have one contract where the ICB will be the lead commissioners, but it will commission the children's community health element, which is funded by the ICB, our own 0 to 19 service, and then Bedford and Central Beds 0 to 19 service. Those services at place, so those services that we're commissioning for Luton will be Luton specific and will be meeting the needs of our Luton families. So I want to kind of just reassure you that that is happening. So that will be very explicit in the specification that we're developing, and then our ongoing contract and performance meetings with the provider. So where we get those efficiencies and economies of scale is sort of higher up, where we've got shared sort of strategic leadership. So some of the senior managers in Cambridge Community Services sit across Bedfordshire and Luton, but actually the teams, our health visitor teams and our school nurse teams, are Luton specific. They're not shared across Bedfordshire. I want to just sort of reassure you there. And just with regard to kind of the provider selection regime, there's been a whole process that we've had to go through, and because we're not making any material change to the contract, we can go down the route which is called Direct Award C, which means that we're just in the process of gathering evidence to meet the 5 key criteria that I put in there. One is value for money, which I've just explained. One will look at quality. One is social value. I can't remember the other two. Innovation and something else, sorry. But we are gathering evidence to assure ourselves and that we're doing, that we can continue with the provider. So that's kind of where we're at. So we're in the process of that commissioning phase at the moment. So really kind of any questions? I think if I miss anything, probably, yeah.
Thank you. Any questions from anyone? Councillor Hussain, yep.
Ask you, every time, you come for in terms of the health inequalities, is it based on need only or a population base? Because Luton is very high in terms of the child health, particularly the obesity, and it is probably far above the national average. So would the funding or would the commissioning that you're doing, would that be based on the need basis or the population? Because always from the previous experience, Bedford and Central Beds gets most of the funding and the need is greater in Luton.
So this is funded from the public health grant, so which is based on a little bit on need and population. And so every public health grant for every local authority is slightly different because it looks at the demographic. So health inequalities is one of our key priorities as a public health team. That's our kind of, I would say, our bread and butter. So you mentioned things like obesity. So the reason that the Healthy Child programme is sort of commissioned and sits within the public health team is exactly what you're kind of describing, is to kind of pick up on things like obesity and have that early intervention and prevention, kind of target sort of populations or communities that have higher sort of health inequalities to kind of even those out. So our 0 to 19 service are, as their public health nurses, they are spreading those public health messages and trying to improve the sort of our children's health and well-being. So does that kind of answer your question?
Are we doing a targeted support? Because in terms of the child poverty, it's greater in certain wards. Example would be Dallow, Biscuit and Farley. It's gone up even by 40% since the COVID. So really one needs to be, resources need to be targeted on where the greatest need is. That is what my serious concern is, that if we have got a very finite budget, unless it's prioritised, it will not have an impact that we want.
So the way that the programme works is that there's a universal service, so there's services that every family will receive, and then there's a more targeted service, so exactly what you're saying. So those areas and those families that are in our wards that have got higher deprivation or higher need will get sort of additional support. And also the programme is starting to link in with the Families First Pathfinder programme that has been mentioned today, and also family hubs. So we're working right across the town, so we kind of know our areas of need, and they'll be working sort of with the communities. So yes, there is a more targeted approach in the areas that are needed and have got higher levels of need.
Because you've got the data already, because you had all that with, with the children's centre or children hubs that are now. So if earlier support can be given to those children at a very early stage, so that we don't have the, it's nothing to be proud of to have way above the national average is not, when your children are not healthy, the town is not. So
Yeah,
that is my serious concern.
I totally understand what you're saying. So we know from our joint strategic needs assessment and our recent family hub needs assessment, we know kind of the data where the need is and how we're sort of linking in. So yeah, there's a lot of need. And also you mentioned sort of poverty there. Cambridge Community Service have pledged as part of Luton 2040 and Child Friendly Town. They're one of our key strategic partners. So they're on board with kind of the town's vision and the staff that work within the service. A lot of them are local residents, and have worked in the town for a while, so they know the Luton sort of families and the need.
Okay, so we go to Councillor Carr next, and then to Councillor Beckham.
Thank you, Chair. Thank you. That's a really comprehensive report and really appreciate that. My question is around, now 0 to 19 is a big age range to cover, and obviously the children have different needs. I know that 0 to 5 have specialist health visitors coming in, but then there's another large sort of area which is covered by 5 to 19, which is covered by sort of schools and nursing services and things like that. Now, I find that the needs of children between 5 to 11 tend to be a lot different. So is within that 5 to 19, do you have teams that focus on different age groups, or is it all just, used under one banner? And because if it is under one banner, my concern is around missing children's unmet needs. So there's needs that could be missed, which could impact not just their health in later life, but also their social well-being, as well as sort of their quality of life in general.
So the service is split into two, so 0 to 5, so which is our health visiting team, and the way that the whole service is delivered is via a sort of skill mix approach. So where we haven't potentially given CCS any additional monies over the years to expand the service, they've had to look at this sort of skill mix approach. So we have a variety of staff at different levels with different sort of specialisms and sort of levels of experience. So the health visiting team has got our health visitors, which are trained public health nurses, which is called SCIFFNs. They've been a nurse and then they've done this additional sort of qualification. And then we have health visiting assistants. So the qualified health visitors will see our families that need more targeted support, and then the health visiting assistants will see the universal families. Your question about the 5 to 11, totally understand that is a big gap. But yes, then in the school nurse team between 5 to 19, there'll be different school nurses that will work within different schools. So we'll have a team that works predominantly in our primary schools, and then more in secondary schools. And then again, that's a skill mix approach with school nurses who are these public health nurses that have done this additional qualification, and then community nursery nurses. So our community nursery nurses might be in schools and delivering additional support on potentially for example, an assembly on oral health or other kind of public health messaging. So where our school nurses will be dealing with our children and our young people that have got those kind of additional needs, they'll be going to sort of safeguarding meetings and that group will be then linking in with the new Family First, Family Help programme that's trying to work with children and families earlier, so that kind of early identification, early intervention.
Just as a follow-up to that then, so within the ICBs, the Integrated Care Boards, or is it Care Boards? Yeah, sorry. So do the teams then sit separately? Then so if you are to report to an ICB, in case because I'm I assume they meet regularly?
So the ICB, the Integrated Care Board, they are commissioners of the health element of the overall contract. So they commission things like the community paediatric service. So they'll have a looked after children's nurse as part of their specification, the speech and language programme, SEND, epilepsy. So we don't report into them. CCS will report into them with regard to their element of the contract and report to us for our Healthy Child programme, but we do it jointly. So we have, from a reporting element, we have a contract review meeting where we meet with the provider, CCS, every month, and that will be jointly Luton, Bedfordshire and the ICB. So that's kind of how that works. And actually that also provides some value for money and efficiencies, because we've got one meeting, it's easier for the provider, and actually from our point of view of resourcing, we're only attending one meeting. The same with the current way that we are recommissioning. To recommission any service, especially a service of this size and value, is very labour intensive. There's a lot of time and money. So we're using resource from the ICB to kind of help with that. So that's saving us quite a lot of money. So, yeah.
Thank you. Councillor Begum?
Just one question from me. With regards to what my colleague was discussing about all the services that you have going into schools, how are you monitoring or engaging with independent schools, and what does that look like?
So the Healthy Child programme up until now hasn't, that it's not within their remit to be going into independent schools. That is changing on the screening element. So we're currently with the screening where they screen in reception for vision and hearing and weight, and then again they screen for weight in year 6. That is just for maintained schools, but that is changing to include independent schools. So as Caroline just said, there's 7 independent schools. Again, that's something actually that we need to look at, because that is going to affect the capacity of the team. So as things change, we're continually asking the provider to do more and more for less and less. So obviously our budgets are stretched. We're not getting any additional monies in the public health grant. So we have to have conversations with our provider to kind of work out what's top priority. And that's where that skill mix approach comes in. And so they will be working with independent schools just for the screening. So, yeah.
What about the vaccinations for children when they're in secondary school? Because there is a set of vaccinations that they have to have, isn't there? Like measles, mumps, rubella, all of that lot when they're in secondary school. Are you able to engage with the independent schools? Because otherwise my concern is that part of our 2040 vision is to provide that inclusive environment and for young people to thrive. If we're excluding independent schools because it doesn't fall in the remit, then we are excluding a significant number of children.
So I'm happy to take this one. So just to make it clear that actually the vaccination programme is not part of the 5 to 19 programme. It's separately commissioned, and we don't commission it. It's commissioned by NHS England separately. However, they do go into private schools and do immunisations in private schools.
Will you be looking at bringing in the hearing eye test and the weight for the independent schools, for primary schools?
Yes, so that will be coming in. So, but the vaccination bit is separate because it's a separate service.
When we can expect that to start coming into independent schools for the young?
I think it's from primary next year. So yeah. And I think with regard to the National Child Measurement Programme, they do already go and measure some children in independent settings in the primary sector, but that will be widened and then become sort of statutory. So I think it's from March next year, but I can come back and confirm that.
So I guess we'll see something in the future in these reports to reflect that. Thank you.
Councillor Froy?
Thank you. My question's regarding the health inequalities. You talk about promoting oral health, But we've got some serious problems with dentists in Luton. I mean, I've only just lost my NHS dentist, all my family, in the last few weeks, and they want to sell us a care plan. You know, and if you've got 4 or 5 kids, that's impossible to afford for some people, and, you know, unachievable, particularly for our vulnerable and less well-off families. Oh, how are we going to tackle that inequality?
So oral health is something that's very close to our heart. So with regard to the 0 to 19 service that we're recommissioning, oral health is just a small part, but we do commission and work with other providers around oral health. So over the last year, we've done a huge amount of work on our oral health improvement. We've had dental pop-up clinics. We have had, we've given out probably over 5,000 toothbrushes to our children, so, and continuing to do that through our schools, through our school nursing team. We're looking at fluoride varnish at the moment, having sort of working with schools so children can have that application of fluoride varnish. With regard to the pop-up clinics, we work with a local dentist where children that attended those clinics were able to be, they're not registered with a dentist now, but they could go and have an appointment, and then and also with us, we've got a supervised toothbrushing scheme, which we're working with early year settings in our schools, and we've got over 65% of our schools signed up to supervised toothbrushing. So you might hear quite a lot in the news and kind of with some of the parties' manifestos of the importance of supervised toothbrushing around kind of the evidence-based. So it's all about getting that kind of prevention, so getting fluoride into our children's mouth. And one of those ways that is proven is supervised toothbrushing. So we've got a really rigorous and robust sort of process. So there's probably a lot. Is there anything you want to add on?
Well, I just wanted to add that when talking about dental access, that is absolutely something that we are very passionate about. However, it's not something, again, that we commission. However, what it has, I don't know whether you're aware, but the commissioning of dentists has changed from a regional level to a much more local level. So that does support our ability to influence and try and support. It's still a national contract. It's still very difficult. However, we now have much closer links as it's moved with the ICB, who are now the commissioners, and we are working really closely with them to, you know, it will take time, but we've got some allies there and we're working to improve that. So it's on our agenda. Unfortunately, it's not something that we necessarily have the power to change, but we are absolutely advocating children and adults. But, you know, in our region, we're obviously working with children as the future around their dental health.
And it is quite a regular agenda item that we have coming here about oral health. I've just looked at the forward plan, and actually I think we need to add that in for the next update as well. I think it's Councillor Pett's next. Thank you.
Yes, my question is really about the amount of drugs that's being peddled around schools. You don't have to walk very far past especially a senior school, to see people peddling drugs. Do we know what the extent of the problem is?
Yeah, happy to take that again. So drugs and alcohol is part of the public health remit. We are very involved. It's not part of the 0 to 19 directive programme, but we have a programme of supporting children and families. We have a worker who you know, she works around educating children and young people, working with schools. We have a number of programmes that go into schools and talk to children and young people. We also work, you know, widely with services. I can't answer your question directly about do we know what is exactly going into schools. We know that, you know, drugs and alcohol, you know, are problems in Luton as they are, you know, in any area, in any schools. So we have, as I say, there is a programme that is going on. We can bring that news. There is a service that is now being recommissioned over the next 6 to 9 months. So now might not be a good time to ask them what they are doing, but actually from this, you know, the moving forward, we can happily bring that back as a more detailed information. Sorry, Michelle.
I was just going to say there's a drug strategy as well. So is it a Bedfordshire drug strategy, which got a really clear action plan. I think sort of that education in schools is on there. So that's working collaboratively with like the police. Robin Porter sits on that board, and so that's quite a very sort of high level. So yeah, we drugs doesn't come under our team as such, but we, you know, it is a priority of the council and the public health team.
So you have some sort of formal programme when you find children that are on drugs, with addressing it with the parents where possible.
There is a provision to support children and families who are affected by drugs, so whether that's children, adults, the families. So we have CGL, which is our drugs and drug treatment service, and they do support families and children.
What about the age range? Do you have any information on that?
No, we'd have to look into that because that doesn't come under this contract.
But you intend to report on this in the future?
We can bring that.
It won't be us, but if you want the children and drugs that need to go on the forward
Jeff,
plan.
I don't think that's really covered under this particular item. I think that's actually more appropriate. Maybe that comes via Dave Collins, and but it's a fair point, and we you know, we can monitor that under the appropriate
So
item.
you mentioned Dave Collins and the youth partnership service. So there is a drugs and alcohol worker that sits within the youth partnership service. That is part of the health element of this wider contract, and also as part of this contract we fund a youth offending school nurse. So and there's a mental health practitioner and a speech and language therapist. So they it's kind of a bit, I suppose, a multidisciplinary approach. So, but they're working with children, young people that are in the youth offending or the youth justice service. So, yeah, if we wanted any more detail around what's happening at schools and working with sort of education, there probably is a bit of information around from the SHU survey, though.
That's what I was going to say. I mean, I think what unfortunately we're not prepared to answer today because we were coming with this piece. However, there are we have a clear area within public health that deal with this. They actually were at Health Scrutiny 2 nights ago to talk about their new service. So we are, we're in that process of redeveloping and setting the service specification that has a much stronger children and young people's element to it. So all I can kind of hopefully is to reassure you that we are moving towards a more rigorous and holistic approach to supporting children and young people affected by drug and alcohol abuse. But we can absolutely, and I'm looking to Councillor Bridge, and we can bring it to another meeting. And you can get more detail. It would be both. It would be safe. Yeah, but it does sit in public health.
Okay, so Councillor Begum and then Councillor Fry.
I just wanted to say, part of the answer to your question, Councillor Petts, was on yesterday's meeting. So last night it was the Health Scrutiny Board meeting to what you were saying. So if you go online, I think you'll find that we did actually ask questions along those lines, and they were answered quite sufficiently. So I think you'll find more information online.
Councillor Fry? Thank you. Any other questions or comments from the floor? No? Let's move on. So yeah, thank you for your report. It's noted. Yeah, we'll move on to the next item, which is the forward plan. So again, this is kind of just to note the work plan. The next meeting, we've had a few items moved back. So we currently have the Youth Justice Plan for 24-25 with Dave Collins, childcare take-up, and the under-18s vaping. So only 3 items at the moment. I will, in our pre-meeting meeting with the officers, see whether there's maybe another item that we can bring forward to the next meeting to make that 4, because I am conscious that subsequent meetings we've got quite busy agendas. So I will see whether we can move something forward to just make that July meeting a bit more productive, shall we say? And again, we'll continue to review the subsequent meetings As you can see, they're all quite busy up to about the January meeting, and we'll start looking at filling those 2025 meetings up, and I'm sure we'll have no problems finding agenda items. Any questions or comments on that? No? Great. Okay. Thanks everyone for your time. Thanks, and yeah, we'll see you next time. Thank you.